A very good morning to all of you. I am Dr. D. Ramesh, Head of Department of Pediatrics, Yashoda Hospitals, Secunderabad branch. Today I am going to talk to you about a condition called pediatric stroke. Any interruption of blood supply to the brain which causes an irreversible brain damage is called pediatric stroke. Pediatric stroke generally is of two types. The blood supply to the brain can be cut off due to an occlusion in the blood vessels which supply the brain. That is called ischemic stroke. It can be generally due to a thrombus, or it can be sudden due to a brain hemorrhage called hemorrhagic stroke. The basic causes are generally we have congenital malformations like any vascular malformations which can suddenly either get occluded or sometimes break, or it can be due to congenital heart disease where the blood viscosity increases and spontaneous clotting in the brain blood vessels occurs. Sometimes due to some blood disorders like sickle cell anemia, where the blood, the RBCs instead of being round, they are like sickles and they go and get blocked inside the blood vessels inside the brain, and they also can sometimes occlude the blood vessels inside the brain. Other conditions like high infections, sometimes severe dehydration also can cause increase in the blood viscosity and cause obstruction. The last is injuries to the neck. This is more important because this is one thing which you mothers can prevent inside the child, because these the other things the doctor has to only tackle it. So common injuries to the saying area is the neck. In the neck we have a major vessel which supplies the whole blood to the brain called the internal carotid artery. So nowadays some schools, not all schools, they are encouraging this contact sports like judo or karate, sometimes boxing, and in some North Indian schools they also they encourage wrestling. So in these conditions, sometimes if the child gets carried away or due to some mistake, the child can injure the neck of the other child. So that's where the internal carotid goes, and a sudden chop to the neck or suddenly somebody holds the neck tight, they can damage the intimal layer of the internal carotid artery, and once that is damaged, the blood platelets keep depositing there and slowly completely block the vessel, which will occur after 1 week. The child or the mother will not know, and slowly the brain will get blocked. The other type of common injury which was presented in Argentina is called the pencil point injury. I'll just demonstrate you. A lot of children in the class, they will sit with their pencil in their mouth like this. So suddenly the teacher will shout at the student and the elbow will slip and the pencil will go and prick inside the mouth. In the mouth we got an area called the tonsillar fossa, where the internal carotid artery is very superficial. So the pencil will go and prick the tonsillar area and slowly blood clot forms there, and after 1 week or 10 days the child will suddenly develop a weakness of the body. So what are the symptoms in childhood stroke? The symptoms, American Pediatric Association is called FAST. F for facial sudden weakness. The child will have a drooping this thing, and when he's talking, the mouth will go to one side. A is for arm weakness. Normal strength in the arm will go down. S is for speech slurring. So slurring of speech. And T is for timely intervention. That is, if any of the first three are there, the mother should immediately rush the child to the nearby hospital. And the main symptom is complete hemiplegia. One side of the body becomes paralyzed. That's what occurs in this thing. Rarely the child will have convulsions and sometimes disorientation. So what is the management? The management is mainly initially, if it is due to hemorrhage, then immediately the child has to be rushed to a hospital and surgery to remove the blood clot and stopping the blood vessel. That is, the blood vessel has to be clamped. If it is a blood clot is forming the thing, then the blood clot can be dislodged with some drugs, and along with that some physiotherapy if there is any slight weakness of the limbs. Prevention, there is nothing, you see, whatever the basic conditions which can cause this, you can prevent. And in case, as I've talked to you about this injuries to the neck, so if any of the parents are encouraging any contact sports in a child, let them wear a good headgear and let them protect the neck. Thank you so much.
Like, comment, and subscribe for more health updates.